these systems on there, and you review that with the patient in the visit, make your pertinent notes, reviewed intake with patient, they deny symptoms in these areas, they have symptoms in these areas, there's your 10 plus systems. But you have to make note of it. You can't just say reviewed intake. You need to go a little further. Past family social history, here are your 3 components. If you don't get any questions asked in those, that's a 213 or a 212. You do one area, you have a 214, and you do 2 or 3 of them, that's your complete. So remember, when we go to our new patients, you need to get 2 or 3 of these so that you can correspond to that 204. Because remember, with HPI, you have to hit, you can only bill as high as your lowest component. So if you only got, you asked the questions 4 or more and 2 to 9, and you got a 214 here, but you didn't ask any past family social, technically you can only do as high as a 213. Physical exam, pretty straightforward. We don't usually do body area. Occasionally I've done a full cardiovascular or a full neurological exam, but typically we're doing it by systems. And so you get a few bullet points out of constitutional, a few out of EENT, you listen to the heart and lungs, and you're very quickly at 3 or 4 systems. 3 or 4 systems gets you to a 213. As soon as you tip over, you check those lymph nodes, and maybe you palpate the thyroid. Now you're up into the 5 or 7, and you're at a 214. So understanding your overarching guidelines here and how many systems compare to which level is going to help not do excessive history. Doing more just for the sake of doing more is not that helpful, but you don't want to, not check their lymph nodes when if you did their lymph nodes, you're all the way up into a 214. When we get to a comprehensive for those new patients, this says 8 or more. Really, it should say 9 or more, because 8 is from the 95 guidelines, and really everyone follows the 97. So that would be 9 or more systems. That means a full physical, basically, a head to toe, a couple of bullet points. I'm not talking about doing every last thing in every system, but you need to have done something in all, at least 9 or 10 of the systems for it to count for a 204 or a 205. I'd say that's where most of us probably fall short on a new patient. When we're talking about our medical decision making or our complexity, these are your diagnoses options. You'll see that self-limited problem, you can have up to 2 ICD-9s times 1 point, so you can get up to 2 points on those if you had 2 self-limited problems. If it's an established problem that's stable or improved, you only get 1 point, but you could have 4 ICD-9 codes, so 4 times 1, you could get up to 4 points if they have 4 established problems, but they're all stable. If something is worsening, of course you're going to get more points for it because it's worsening and you're going to have to put your thinking cap on. New problems, you're going to get more points. New problems with additional workup, now you're really having to think, and you're going to get 4 points. So you don't need to have more ICD-9 codes or more diagnosis codes does not always equal more points. If you have someone come in, let's say it's a new problem, someone comes in with fatigue, and you don't know why because you've never seen them before, that's a new problem with additional workup. You're going to get a blood count, thyroid, whatever other testing. That's 1 code times 4 points. That's 4 points. When we go down here, 4 diagnoses points corresponds to a high-level visit. It's not everything. We still have to take into account these other pieces, but more is not always better. Less, but more thoroughly worked up can be just as complex a visit. So don't do more work